First on 5, COVID sickouts impacting hospitals, the staff shortages coming at a time when COVID-related hospitalizations begin to rise. Thanks for joining us at 6. I'm Dina Herrera Garza. This is a situation right now in Hidalgo County. 162 currently hospitalized. 87% of those in need of medical care are adults. It's a high number, but we're still better off than what we were this time last year. 1 year ago today, 381 people were hospitalized with the virus. In Cameron County, hospitals are short-staffed because of COVID. But as Channel 5's Stephanie Rosales tells us, they're getting some help from the state.
Many hospital employees testing positive and having to stay home sick, on top of a staffing shortage that's already been going on for months.
It's a larger number of employees that are out at one time, where before the number was a lot smaller. So that does impact staffing. It impacts being able to open up all the beds and to take care of the patients of our community.
Amy Flores, Chief Nursing Officer at Harlingen Medical Center, says they're at about 75% staffing to take care of the beds that they do have, adding more to the stress workers have already been under.
You know, we're 2 years in, and, you know, a lot of people are tired. Some people have left the profession or they've left their local jobs and have taken on traveling jobs because, you know, it definitely pays more.
Flores says they are getting some help from the state in the form of more nurses.
We don't know how long they will stay this time, but last year we've had several that were here for 4 months. And so that will vary.
Flores says the state will determine how long they will stay. County Health Authority Dr. James Castillo says so far, even though positive cases are climbing, people aren't getting as sick as they were before.
Or a lot of times they're getting hospitalized with normal medical problems that would put them in the hospital anyways, but are testing positive for COVID, which makes it more complicated to care for them.
Castillo says new CDC guidelines regarding the isolation period for healthcare workers allows them to return to work sooner after testing positive, as long as they wear a mask and are symptom-free.
But it allows them to go back to work after 5 days. And so that really decreases the time a person can be out, and it could really help a lot with these types of workforce issues. And these changes in policies are really to reflect on trying to keep critical infrastructure running.
As of right now, the CDC is scheduled to give another briefing on COVID tomorrow morning at 10 o'clock. Stephanie Rosales, Channel 5 News at 6.